Thank you. All right, up next, reports, number 1, campaign and initiatives.
Yes, so what you have in your packet, Board of Directors, is our flu and COVID-19 vaccine campaign final report. This was in partnership with CV Pharmacy, where we hosted a series of COVID and flu vaccination clinics starting December 1st all the way through the end of the year. As you see there in the infographic, we had a total of 29 vaccination clinics at 25 locations, where we administered 1,141 vaccines. The breakdown of those vaccines are 694 flu vaccines, 431 COVID-19 vaccines, 5 RSV, 6 shingles, and 5 pneumonia. Out of those 1,141 doses, 919 district residents were the ones that received those vaccines. Out of those 919, 598 were insured, and 321, totaling 35%, were either uninsured or underinsured. So this continues our vaccine campaign that stemmed from our COVID-19 work and then the US Aging Grant. And then now we kind of have taken that on our own. And to answer, Dr. Logsden's question, the approximate per vaccine during the period billed was $22.04 for our efforts.
Thank you. Any board comments?
Great work.
So,
Okay.
What he said.
Great work.
so,
Great work.
so we won't be continuing our vaccine clinics.
For the contracted period, that's what we had stated when we entered into the agreement with CV Pharmacy. I'm more than willing, based on board direction and leadership direction, if that is something that we want to contemplate moving forward. We know we are coming towards the tail end of the flu season, but that is something that I'll take direction from Chris, ultimately the board.
Next year, flu season.
If the board would like to give direction, that's fine.
I think it's important that we, as a public health entity, that we offer free vaccines.
I agree. Thank you. We'll go ahead and take a comment and then.
Sure. I think excellent job on the numbers. I think that speaks to everything that you can do. If you can deliver a vaccine for $22 effectively, that's better than almost anybody. If you go into a clinic to deliver a vaccine, the facility fee alone is probably $150 to do that care. So being able to do it this way is tremendous. I would like to have the board consider opening up to the pediatric population in terms of vaccinations. Just a personal story real quick. My sister adopted a baby. She had to get him vaccinated. Insurance didn't cover it. She has a good job, everything, and $1,100 out of pocket to get vaccinated. And we were doing it for $22. And I think we should open it up to everybody. There's very little pediatric care here. So I think we should really look at the impact. I think the flu, obviously everybody wants to get the flu. The COVID, I think, is plus or minus, but I think there are some pediatric vaccines that are out there that we should support and sponsor as well, and look into that.
To answer that, Dr. Logsden, we do that through our DPMG Health. So we do set up vaccination clinics with all 3 school districts, where we offer the MMR, Tdap vaccinations for school-age children requiring that. And we do receive a lot of asylum-seeking children that come into our district that have no vaccination record whatsoever. So we do start them with under the California Vaccination Registry. We get them up and going so they could have some documented vaccine on file, so then they could enter our school districts here locally. So we do target the children through our DPMG Health mobile clinics.
Thank you. And then do we have a consensus that we would like staff to, or direct staff to continue working or determining if we could continue with this campaign?
Yeah.
Yeah, I think in that direction, maybe look at expanding what you do and come back with a proposal to say, hey, here's what we did this year. It was very effective. What more impact could we have?
Love it.
Perfect. Thank you. Next item B, and then we'll do public comment after ABC.
With item B, there's no thing to report right now. We are working with DPMG Health to renew their contract. We are looking into a couple of options with them, so hopefully by next board meeting, we'll come back with a proposal to renew their agreement.
Any member comments?
Is their contract included in the budget?
That's what we're working on. In this year's budget,
Yes.
If you think back to the list of grant applications, there's one that's in works for $2.4 million in that upper section. We are working on, as Alejandro's talked about, another opportunity, maybe working with them, with EPMG on like a contract basis on a short-term basis, just for like a per event type of cost, and then working with them to develop a longer term grant application. So I think that's the direction that we're going in, which will help line up with our remaining grant budget concerns that we have. So, and if we have, the 3 million and works to where we can do, a larger grant, we'll do that. But I think this way will work better in the short term.
And my last question was the schedule. People have asked me about where CPMG is going to be when and where. Is that posted somewhere?
we are currently working on a tab on our district website where we are going to have a schedule not only for the DPMG Health, but also for the women wellness clinics and also the vision clinics that we are currently under contract. Yes. Yeah, so we'll have all of that.
Okay, thank you. Next item.
Next item, this is a combination of staff report and infographic and a personal story that we would like to share with the board of a client of ours that participated in one of our first women wellness clinics. What you see in your staff report and the infographic is a couple of the first contracted events that we have with the Pink Journey Foundation. As you see in the infographic there, we were able to do 255 mammograms. 59 of those were women who had the first time, that had the mammogram with us for the first time. 32 of those needed a follow-up call, a follow-up care, which is, very unfortunate, but luckily we were able to, to connect those women to the appropriate resources to continue their follow-up care. Same thing with the pap smears that are done by DPMG Health. We were able to do 156 pap smears. 34 women had their pap smear for the first time with us, and 18 of those had to be referred for follow-up care because of some abnormal reading. The one statistic that's really, really impactful is that half of the Coachella Valley women who participated in our events were uninsured. So very, very staggering statistic there. And thanks to Megan, who created this infographic with the data and some of the percentages here. Also, the above average callback rates, 12.5% for mammograms and 11.5% for the pap smears. So this obviously highlights the need for effective early detection, which we are doing out in the community both with our mobile units, doing the pap smears through DPMG Health, and the mammograms that are conducted by the Pink Journey Foundation. And we do have a couple of events coming up. February 21st at Quintero City at Esperanza Park. We'll be there from 9 to 4. And then we're also in communication and talks to participate in the California Care Force events, where we will be providing the women wellness clinics on site at that during that event on Friday and Saturday. So we're very proud to be partnering with the California Care Force. They're also a grant recipient of ours for a mini grant for that event. So we're very happy to be able to establish that partnership and be able to provide services that are on site for the women that need those services.
Thank you.
And with that, I would like to call up Sergio and our special guest who will be giving us a testimonial of her experience in one of our events, and Sergio will translate for her. So, Sergio.
Hi, good afternoon, everybody. Thank you, Alejandro. Yeah, my name is Sergio, and we have here with us today Claudia. She is one of the first patients that we had starting the Women Wellness Clinics at Pap smears. We're very grateful to have her join us, especially since she is coming out of the radiation treatment today. So I'll let her speak about her story, and I'll translate for you all since she's going to do her speech in Spanish.
Hola, buenas tardes. Gracias por darme este espacio.
Hi, good afternoon. Thank you for giving me this space.
Escribí algo para que no se me pasaran los detalles importantes.
I wrote a couple of things down just so I make sure I don't miss any important details.
Okay. Hoy estoy aquí profundamente agradecida con el Distrito de la Salud.
I am here today, very grateful towards the Desert Healthcare District.
Llegué a una campaña en el mes de febrero del 2025, donde tuve una excelente atención por parte del Distrito de la Salud.
In February 2025, I came over to one of the campaigns where I got a mammogram done, and I had excellent service.
No imaginaba lo mucho que iba a cambiar mi vida. Llegué a hacerme un mammogram gratuito.
I never imagined how much my life would change. I came to get a free mammogram.
En ese momento no tenía síntomas ni dolor y solo pensaba que todo estaba bien, hacerme un chequeo de rutina.
At that moment, I just came thinking I was going to get a routine check done with no symptoms, no pain, no anything.
El estudio detectó algo que yo no sabía, cáncer de mama metastásica.
Then I got a call back, which was diagnosed as cancer, metastatic cancer stage 3, breast cancer.
La noticia para mí fue un golpe muy fuerte. No tenía recursos para cubrir mis gastos médicos.
This was a very heartbreaking news for me. She had no resources to cover her medical costs.
Pero no estuve sola. Desde el primer momento de mi diagnóstico, el Distrito de la Salud me dio apoyo real, humano y constante.
But she was not alone. Since day one, the Desert Healthcare District was able to help her in a humane, in a
Apoyo humano, real y constante.
real and constant support.
No solo me dieron un diagnóstico a tiempo, también me ayudaron a tramitar mi aseguranza, me orientaron y me han acompañado cada paso.
Not only was she able to get a early detection diagnosis done, but she was able to also get our assistance with enrolling into Medicare and eventually into her medical treatments.
Gracias a eso, hoy estoy recibiendo tratamiento, hoy tengo oportunidades y hoy tengo esperanza de vida.
Thanks to that, now she is receiving treatment today. She is undergoing her cancer battle, and she is
Que tengo esperanza de vida.
and she has hopes for life. Sorry.
Ok. Quiero decir algo importante. La detección temprana salva vidas, pero solo funciona cuando hay programas accesibles y personas que de verdad se preocupan y ocupan de la comunidad.
She wants to make something clear that early detection is important and it saves lives, but it only works when there is people with the heart to do so, with the desire to help the community in that regard.
Mi historia es la prueba de que cuando el Distrito de la Salud invierte en prevención y acceso a la salud, se salvan vidas.
My story is the proof that when the Desert Healthcare District invests in prevention, it helps people save lives.
Aún así, para mí no ha sido fácil debido a mi situación de salud, paré de trabajar.
Even then, my situation has not been a easy one. I did have to quit my job to make sure that I got the treatment.
Quisiera hacer una sugerencia. Si pudieran incrementar un apoyo financiero a estos programas.
And as a suggestion from a community member, she'd like to see more funds going into these type of programs and financial assistance in general.
Ya que es complicado en casos como el mío y el de muchas mujeres más.
Based on her cases, she knows that it is complicated, her financial struggle, and she knows she's not alone in that struggle in Coachella.
A veces muchas mujeres no se hacen un estudio por miedo o por falta de información o por no tener los recursos suficientes.
In many situations, women don't go through with getting a exam such as mammograms because of lack of insurance, lack of information, or lack of knowledge.
Este programa elimina esas barreras
Programs like this eliminates those barriers,
y yo soy prueba viva de eso.
and she is proof of this.
Gracias al Distrito de la Salud, a las organizaciones y a todas las personas que hacen posibles esas campañas.
She's thankful for the Desert Healthcare District, the rest of our partner organizations, and everybody else who participates in these campaigns and programs such as ours.
Lo que ustedes hacen no solo es trabajo, es vida.
What we are doing here at the Desert Healthcare District is not only a job, it's not only work, it's giving life.
Gracias por pensar en nosotras, por no soltarnos y hacer la diferencia.
She wants to thank everybody for thinking about the community, thinking about women in the situation, and not letting go of the situation without doing something about it.
Perdón. Sin este apoyo no hubiera existido. Yo hoy no estaría hablando aquí con ustedes. Gracias.
Without the support of the Desert Healthcare District and other resources, she would possibly not be here today, and she's very grateful and she thanks us once again.
Queremos decir unas palabras. Primero que nada, te agradezco tu valentía. Hiciste que se me pusiera la piel chinita, porque muchas veces he estado en una posición similar donde yo y mi familia no teníamos seguro médico o no podíamos, no nos alcanzaba para comer o dónde vivir. Entonces, estando ahora de este lado en un puesto donde las cosas que trabajamos como mesa directiva con nuestros miembros del equipo, y escuchar historias como las tuyas, testimonios como las tuyas, solamente nos deja saber aún más que lo que estamos trabajando en realidad es un impacto o está cambiando vidas. Así que, pues todo el apoyo, te deseo todo lo mejor en este camino, en tu salud, para ti, para tu familia, y sabes que escuchamos tus palabras, así como me encantó que tenías una petición de, hey, échale más dinerito a estas alcancías, a estos programas, y te aseguro que esas palabras las escuchamos y en eso estamos trabajando. Eso es uno de los programas que cuando cuando entré a la mesa directiva inicial, dije, hey, se necesita algún tipo de servicio así. Entonces, personalmente es todavía muchísimo más recompensante saber que sí estamos impactando vidas y lo estamos haciendo de un nivel no tan de alta escala. Ahora te imaginas, o yo me pongo a imaginar estando en esa posición, ¿qué tal si empezamos a invertir aún más dinero en estos programas? ¿Cuántas muchas mujeres allá afuera vamos a poder ayudar para que puedan tener una detección temprana? Así que te bendiga, gracias por tu valor, gracias por venir a presentar y les voy a pasar el micrófono a mis colegas por si tienen algo que agregar. Anything that you would like to share?
I agree.
Okay.
Second that. I got some of it.
Nomás para usted le quiero decir gracias por compartir su historia y dándonos la oportunidad de saber que lo que hacemos es importante. Okay. Y voy a hablar en inglés porque quiero que los demás sepan porque esto es tan importante. Okay, I just said thank you for sharing your story because it gives us purpose for the work that we're doing. Okay, and yesterday we were attending a strategic planning session, and one of the questions, the opening question, what makes you most proud? And this is it. To be able to make an impact. Gracias. And also, one of the programs that we sometimes get a update on is the cancer support program. And that program that is very well used in the West End, but is not as well used in the East End. I think that kind of program is just, we need to visit it again because it's so much needed to be able to help families, the support that they need throughout this process. You get that call and they tell you what the prognosis is, and I don't know how she did it to be able to get up and to do what needed to be done, and her family and needing to support her. And so again, I think I just want to say, let's revisit it again because we need to be able to support them through the journey. Y otra vez, muchas gracias por estar aquí y por darnos esperanza para el futuro para usted, porque sabemos que es tan importante que esté aquí para usted y para su familia. Gracias por todo.
Gracias por compartir tu historia haciendo un gran impacto en mí y en nuestra visión para nuestra comunidad.
Pretty good.
Sorry, I don't speak Spanish very well, but I will tell you, thank you so much for sharing your story. I think, as you can see, you truly had, your words had an impact on us. And it's because this work, like Letty was talking about, you know, we do it for love of the community, for care for the community, and the fact that you were willing to come and share a very personal story with us about what you're going through and the impact that a program that the district has, but the impact that it has had on your life was extremely meaningful. So thank you so much for being here. Thank you.
Bueno, pues muchísimas gracias.
Before we close, Sergio has been very crucial in helping her because multiple appointments, you know, filling out applications for her, connecting her to find food bank to get food deliveries when she's not feeling well. That's the type of case management that we do when we call back all of the women that participate in our women's wellness clinics. We connect them, we talk to them on a personal level. We ask them, do you know what those results mean? Do you need help? What else do you need help with? And that's the personal kind of level that we are implementing in our women's clinics, our vision clinics, and our local clinics, residents. So that's just one example, but I wanted to acknowledge the hard work that Sergio has done with her. You know, picking up, you know, the applications, getting all of the backup documentation, completing the application for her, picking up food boxes and taking them to her home. That's the type of, you know, commitment that we have to our district women that are participating in our women wellness clinics. And I appreciate the support from the board in expanding this program. Now we have 19 more events with the Pink Journey Foundation that we're going to continue to save lives and have stories like Lily. So thank you.
Thanks, Sergio. Thank you.
Muchas gracias.
Excuse us, I need to get her home.
All right, thanks. Next, E1D.
Wow. It's kind of hard to shift gears there, but the vision clinics that we have with Lestenac Free Clinic are going tremendously. Just a background, we hired them to do 12 vision clinics throughout the Coachella Valley. To date, We've done 2 vision clinics. We did one at Our Lady of Guadalupe, in Mecca, which was on Saturday, December 13th from 9 to 3 p.m. And then we did one here at the Rap Foundation on Saturday, January 10th, once again from 9 to 3 p.m. And the outcomes to date, we have provided 130 vision screenings, distance glasses that were cut and prepared on site. We provided 94 of those. We provided 81 readers to those individuals that needed them. And then we had 23 patients that were referred to the Lesser Neck Free Clinic in San Bernardino to do further testing because they detected some kind of eye issue. So the staff that we have on the vision mobile unit, they do a vision screening, not a vision exam. So some of those individuals, those 23 individuals, were referred to the San Bernardino Clinic where they are able to see an optometrist and have a more in-depth exam. So we have a couple of upcoming clinics. We have one at DHS High School on Thursday, February 5th from 2 to 7 p.m. We have one at Esperanza Park in Cathedral City, Saturday, February 21st from 9 to 3. And then we have one at North Shore Elementary on Saturday, March 28th from 9 to 3. And just a little quick footnote, all of those are booked already. Within us releasing the flyer, within 1 hour, all 65 appointments are booked.
Wow.
Yeah, I was getting ready, Sergio called me, I was getting ready to head out to Sedona with my family over the MLK Junior weekend, and he said, hey, there's something up with the registration site. I'm like, what's going on? He's like, Belen just called me. There's no more appointments because we use Belen's cell phone as the landline for folks that could not do the registration online. We have, her phone number, so she walks people through the registration. For those that would like to talk with somebody instead of dealing with a computer. And sure enough, I logged onto the registration site and all 65 appointments were booked. I told her, shut off your phone, change the message on it and say, hey, we are booked. If you want to be added to the waiting list, please leave your name and number, and we'll call you back to enroll you into one of our upcoming vision clinics. So phenomenal work that we're doing. The equipment on that machine, and hopefully some of you could attend and see in person the process that happens. They have a machine. I didn't know that glasses have a code on the side of them. There's a little specific number. They type that into a scanner. They scan the size of the lens on the frame. And then they have lenses that are just circles with the prescription. And then they put them into these water jet machines that cut the lens into the size of the frame. They clean up the glass, they pop it into the frame, and then that person walks away with a free pair of glasses, all within an hour and a half, which is phenomenal. So really great work. There's a couple of things in the work. We're exploring possibly purchasing our own vision mobile clinic. So that is something that, I've been having a conversation with Chris at Lesser Neck Free Clinic. They have a new vision mobile unit that I went and saw this last Friday to just kind of, start inquiring about the cost and, how it, instead of rolling it out once a month, I would like to have this out 2-3 times a week out in the community and just providing these glasses. Their total cost for a pair of glasses is $5.
Amazing.
It really is. Any board member comments? You can beat that, right, Tim?
That's pretty good. But I'm gonna tell you, because I work in the hospital every day, the need for this type of care, and I'm talking about returning eyesight. So you're talking about vision, hearing, and then also dental. That the lack of care out there, and it's not met at any hospital level because the hospitals aren't here to do that. ERs aren't here to service that. It's not an emergency if you can't see, but it is for you if you're living with it. So I think, we talk about our budget and our expansion. You want to talk about an impact that you want to spend the money on. This is having a direct impact on lives immediately, and it's not being met anywhere. And I don't think that other nonprofit organizations are going to be able to do that. It's going to require us to partner and hopefully take some leadership like Alejandro has in terms of organizing these, putting the plans together to get them started. And then our job is to really amplify, right? That's the word we keep talking about, is amplify. This is a program we should amplify because the need for vision here I mean, you said it was filled up instantly. I'm not surprised. I have people come into my clinic all the time. They can't eat. They don't have teeth. They need to see a dentist. There's nobody out there doing this for the majority of the community. And these are people that are insured and uninsured. It doesn't matter if you're in the East Valley or you're in Palm Springs. It's a huge unmet need.
Is there? Since we've decided that there's such a huge need, is there maybe a consideration to increase the budget in order to expand the services that are already planned?
You need a plan.
That's above my pay grade.
You need to have.
So can we direct staff to come up with a plan in order for us to increase the service?
Yeah, and that's what Alejandro has indicated is that thank you.
Is that we're in process right now of developing a plan and a program. So we will be bringing to the board a recommendation for budget and expenditures, because we plan to promote us purchasing an actual manufactured unit, just like we did our mobile medical units. So we will be coming to you with a proposed plan. So thank you for your support as the board and giving direction to staff to proceed with that.
Thank you.
I just want to say to Alejandro and staff how wonderful your work is and how you make the district look really good.
It's a team effort. It's a team effort. I just happy to lead it, but we couldn't do it without the board support, leadership support, marketing, communication, fiscal. Everybody has a hand in our success, and I just happen to be out in the community executing, with those resources that are given to me.
And one more comment about, we talk about data at our strategic plan. This data right here, how quick did your appointments fill up?
An hour.
So that data right there is huge. Where is any public health official commenting on the need for increased vision in the community? We can tell you that 54 spots filled up within an hour. That data is critical for us to publish. That should be a frontline article out there about the need for this. Open up a clinic and within an hour, all of it, that's 1 a minute, right? And you had to turn off your phone.
Alejandro, just for clarification, I had understood that was for the mammogram, for the 1 hour that it got filled up. Was it for the vision?
For the vision, yeah.
Oh, okay. Okay, so now we have 2 very successful outreach programs. Okay, thank you.
I just wanted to say too that I volunteered at one point at one of the schools where we had Vision to Learn there. And I was overwhelmed by the numbers of children who had vision problems that were not detected. And what was also amazing to me was that the high number we have, of course, in Desert Hot Springs, a high number of Hispanic children and families, but a higher increased prevalence of vision problems in Hispanic children. And I don't know if anybody's looked at that. And, is it nutrition? Is it growth and development? There's a huge public health problem there.
Yeah. And part of that too, we are collecting data. I've been working with Megan, and Megan, helped us. Megan helped us develop a questionnaire, that we give to the people when they come into the vision clinics and all clinics. Megan has been phenomenal in helping us with the data collection and designing surveys, so we were able to capture data to show the need, the impact. Some of those questions is, if you didn't come today, how long would you have waited to get a pair of glasses, or when was the last time you had an eye screening? And folks, as you mentioned, folks that are insured, they come in with tape on their glasses because they have to wait 1 year, 2 years until their insurance approves another set of glasses, or even their vision changed within that year or two, so they have to wait. Luckily too, one of the things that we found out in the first couple of events is that they're able to see children. And they have very specific glasses, and it's a nice setup. It's not like, like other vision programs where they have donated glasses. They have the frames. You're able to select really fun frames. We had a little kid that selected some red ones because, his favorite comic book character was Spider-Man. He said, I want some red ones like Spider-Man. So he got some red glasses. You know, so they're able to pick their own frames, you know, up for their style. And then we're able to develop to give it to them with that same day. You know, even us with insurance, we go to the optometrist, then we have to pick up our glasses, you know, a week or two later. But with us, they get them right then and there. So it's just an amazing program.
Thank you. All righty. Any public comments on this item?
I would like to make one additional comment. As we're discussing this and we understand that it's real life right now. I mean, we're experiencing the great results from this. And it is a high important need. I think of it in correlation with our strategic planning that we're building out. And we've been talking recently about, you know, our key initiatives and the tactics and that in developing that plan. So this falls right in line with that as we're building that strategic plan out. Thank you.
Thank you. All righty. Next item, F committee meetings. One, finance, legal, administration, and real estate. Anything to add? Anything? No, any questions? Any public comments on the item?
No public comment.
Okay, next, program committee. Any questions for members? Program committee, Alicia? Any public comment? All righty, so with that, any closing comments? No, we're good. All right, we're gonna go ahead and adjourn this meeting at 6:34. Thank you.